And we're back with our politics lead. The government shutdown, the spending talks stalemate here on Capitol Hill. Democrats so far not willing to bend on their demands for Obamacare subsidies to be extended and more. Here with me now is the leader of the Democrats in the House, Minority Leader Hakeem Jeffries, Democrat of New York. Thanks for being with me, Leader Jeffries. So you maintain Democrats are ready to come to the table anytime with anyone at any place on any spending agreement. Vice President J.D. Vance today said the president's open to coming to the table on health care once the government is funded. Where are we at negotiations right now?
Well, we haven't heard from the White House since the White House meeting on Monday. President has been behaving, somewhat erratically and in an unconventional fashion in the context of the government shutting down. Clearly, they wanted to shut the government down. Unfortunately, we're ready to work together to bring it back open, but to do it in a way where we enact a spending agreement that's bipartisan, that meets the needs of the American people, while at the same time addresses the Republican health care crisis that is devastating everyday Americans all across the country.
So you said erratic, and I believe you used the word unhinged the other day.
I did.
Are you trying to draw a line between President Trump's acuity, his mental state, and what's going on here with the shutdown?
No. I'm actually referring to some of his social media posts, which didn't seem to make a lot of sense.
The sombrero and the mustache?
Correct. Well, it would seem to me that as the President of the United States, on the brink of a government shutdown, if you actually wanted to bring everyone together to try to get to a resolution in a common sense, bipartisan way, that's not the type of behavior that we would see. So hopefully, moving forward, whether it's President Trump or Vice President Vance, Speaker Johnson, Leader Thune, that we'll actually come together to have a conversation to figure out how we can get the government reopened immediately, stop this pain that Trump is inflicting on hardworking American taxpayers, and at the same time resolve the Republican health care crisis, particularly as it relates to the Affordable Care Act and their refusal to extend the tax credits, which is going to result in tens of millions of Americans experiencing dramatically increased premiums, copays, and deductibles.
So right now, J.D. Vance says he's talking to other Democrats in the Senate. 3 Democrats, or 3 people that caucus with Democrats: Angus King of Maine, John Fetterman of Pennsylvania, Cortez Masto of Nevada. They voted to proceed for the continuing resolution. They only need 5 more Democrats. Are you worried at all about the more moderate Democrats caving?
Not at all. In fact, what I think, constructive conversations are positive. I don't know that these conversations have been constructive because for the last several months, what we've seen from the Trump administration is that they've adopted a my way or the highway approach. Now, if you adopt a my way or highway approach and then you drop on us a partisan spending bill that continues to gut the health care of the American people, then the reality is they are going to drive us toward the government shutdown.
The partisan spending bill, is that the one big beautiful bill or the continuing resolution? Because the continuing resolution just funds the government at the current level.
Well, actually, the continuing resolution that they have presented to the Congress is a partisan bill. House Democrats voted against it in March because it hurt veterans, hurt seniors, hurt children, hurt child care affordability, hurt housing affordability, and hurt health care, which is why we opposed it.
You're saying that Chuck Schumer then voted for a Republican partisan bill because he voted for that, so did 9 other Democrats in the March.
Well, Chuck Schumer did explain his views on the merits of that bill at the time. I don't think he ever disputed that there were challenging parts of that legislation. The partisan bill is the one that's before us now. A bipartisan agreement on spending had actually been reached in December, bipartisan majorities in the House and the Senate. Joe Biden signed it into law. Then President-elect Donald Trump blessed it as well.
So let me ask you about a provision that the Republicans are talking about quite a bit. I know you want to talk about, and Democrats want to talk about, extending the Obamacare subsidies, which expire at the end of 2025. But they talk about the provisions, and it's right here, subtitle E, and this has to do with the repeal of health care subtitle changes, and specifically what it is. How they characterize it is, you want to give health insurance to undocumented immigrants. I understand that's not really an accurate depiction, but what it does do is...
It's a lie.
It's a lie, but what you support does bring back funding for emergency Medicaid to hospitals some of which does pay for undocumented immigrants and people who don't have health insurance. And also there is this provision, and it's not about undocumented immigrants, it's about people with asylum seekers and people with temporary protected status, et cetera, but about their ability to get Medicaid. So they're non-citizens, they're not undocumented, they're not illegal. Why even include that in a bill knowing that they're going to seize right upon that and use that to message? I understand that when you retake the House, you can get whatever you want passed, but at this point.
Well, what we're doing is fighting to protect the health care of the American people against the largest cut to Medicaid ever. 14 million American citizens are going to lose their health care as a result of what Republicans did.
You're talking about the
with that one
subsidies
big
again,
ugly
but
bill.
I'm talking about the non-citizens.
No, I'm talking about the Medicaid cuts. That document that you just showed me, that was the one big ugly bill. 14 million Americans are going to lose access to health care. Their hospitals, their nursing homes, their community-based health clinics are closing because of what the Republicans have done. These are hard-working American taxpayers, and the Republicans know they're lying about this issue. By the way, current federal law is clear. Taxpayer dollars cannot be spent on Medicaid or Medicare or the Affordable Care Act related to undocumented immigrants, and not a single Democrat has raised the issue of trying to reverse that federal law. What we are trying to do is save the health care of the American people, lower their costs, and cancel these cuts.
Do you not think that the provisions that provide health care for non-citizens muddies that message?
No, you're referring to emergency care
Yes.
that some states might administer based on state law. We're talking about federal law. We don't have the ability to change state law.
So let me ask you about this threat from Ross Vaught, the director of the Office of Management and Budget. He announced that the White House was He announced that the White House was freezing roughly $18 billion in New York City infrastructure, quote, due to unconstitutional DEI principles. He added that's going to impact the Hudson Tunnel project and the 2nd Avenue subway. I doubt it's a coincidence that you and Leader Schumer are both from New York, probably even occasionally ride that subway or use that tunnel. What's your response?
Well, it's an attack on working class Americans. It's an attack on good paying union jobs. It's an attack on teachers and social workers and nurses and firefighters and police officers who are going to rely upon the transportation that will be enhanced by those projects, not just in New York City, but in New York State, as well as in New Jersey and in Connecticut. It's interesting to me. I wonder why Mike Lawler or others haven't said anything. It's going to have an adverse impact on his constituents. But this is the type of thing that we've seen from the Trump administration. These people are obsessed with retribution, as opposed to actually doing what they promised. They promised, Jake, to lower the high cost of living on day one. But costs aren't going down in America. Costs are going up. Inflation is going up. America's too expensive. The Trump tariffs is making life more unaffordable for millions of Americans who are paying thousands of dollars more a year because of the erratic Republican policies. And now they actually are going after these economic development, job-creating engines to hurt not Democrats or Republicans, to hurt hardworking American taxpayers.
One last thing before you go. I know you said you thought it was racist and bigoted, that sombrero and mustache AI image that President Trump put out there.
That wasn't simply my characterization. That was a broad characterization by a broad number of people.
J.D. Vance said he thought it was funny. Vice President Vance said he thought it was funny, and he said he didn't understand why you thought it was racist because you're not of Mexican heritage.
It was a xenophobic stereotype, which is why we've heard from many Latino organizations denouncing what took place. But the broader issue, I'm not going to dwell on the president's erratic behavior in terms of the meme or the AI deepfake videos. The broader problem is it's deeply unserious. And this is a serious moment. We need to reopen the government. We need to enact a spending agreement that's bipartisan, that actually meets the needs of the American people. And we need to address the Republican health care crisis.
Democratic leader of the House of Representatives, Hakeem Jeffries of New York.
Thank
you
you
so much. Good to see you. As always, we'll be right back.